What I can say is we have changed a lot. When I first trained, we didn't have targets. We didn't treat to a target. We just wanted people to feel better. So the message was still a message of hope. But really, since the treat to target days, we've realized that if we try to treat to a low disease state and optimally for most patients remission, we are about twice as apt to obtain that target than if we just are sort of lackadaisical and just say, here's your drugs and hopefully they'll work and off you go. And I'm still giving you a message of hope. However, we have the 1 in 5 who are pretty high disease activity, often starting, who don't get a big change in treatment over time and don't really obtain that, for them, the holy grail of remission. So the higher you start, if you don't get a rapid response, the less likely you'll be in remission at 3, 6, 9, 12 months, and even 24 months. And who knows beyond that as you alter therapies. I think as well, we've learned from CATCH a lot of differences. So there are both sex differences and some risk factors. So interestingly, women compared to men start a bit higher. They get the same delta or change in response. But if you start higher than men and you get, say, a 3-point DAS improvement, which is very clinically relevant, if you start at a DAS of 6.2, you end at a DAS, say, of 3.2. If a male starts at 5.8, and they get a 3-point change, they end in a 2.8, which is low disease activity, and many of them potentially in DAS remission of less than 2.6, because that's the mean. So that's been known a long time. But there's also what I'll call interaction terms. And what do I mean by that? Women who have the highest BMI have the least chance of remission, and in particular, if they're anti-CCP positive. When we look at the men, and Sue Bartlett and others have looked in great detail on this, if we look at men who smoke, so it's not about BMI, but about smoking, they're less apt to obtain remission. And in some data, not so much supported by CATCH, but not unsupported by CATCH, men who are rheumatoid factor positive who smoke will have less good outcome on average.